Hello everyone, I'm Dr. Haroon Latif. I'm a clinical embryologist from Lahore, Pakistan. I'm also a member of Executive Board of Aspire. Firstly, I would like to thank the Education Committee of Aspire for giving me this opportunity. I tell my colleagues and friends that one good thing that came out of COVID is that we've gotten so used to doing these webinars and Zoom meetings that it feels almost normal. So I'm going to present today assisted hatching, evidence in 2020, and what has happened since the last Cochrane review, which came out back in 2013. Basically, this is in continuation of the initiative Aspire has taken, talking about add-ons in IVF or ART. As we all know that add-ons include certain procedures or medications which we use to complement normal ART cycle. And the big question is whether these add-ons, do they actually help to improve the outcome of an ART cycle, or whether or not do they have any detrimental effect on the outcome of an ART cycle. As we all know, there are a number of add-ons which we have used or are using over the years, such as endometrial scratching is one of them, time-lapse imaging is one of them, and of course, assisted hatching, which has been talked about for almost 3 decades now. So the background is that failed implantation may be due to inability of a blastocyst to hatch and attach itself to the endometrium in the uterus. Assisted hatching is a procedure which was introduced as far back as almost 3 decades ago. And the reason for the introduction of this assisted hatching was to improve the implantation rate. Assisted hatching basically involves thinning of the zona pellucida of the embryo, or even making a gap or a hole in the zona pellucida. Normally, we use around 3 methods to do assisted hatching. Initially, when it started, a chemical method was introduced, which is in which acid thyroid chemical was used to open up a gap in the zona pellucida or thin the zona pellucida. The problem with acid thyroid or the use of chemical was that you need a certain level of skill set to do it. It was pretty difficult because an extra spill of acid would definitely harm the embryo and even damage it to the extent that it won't be transferable. Second method is the mechanical method, in which we use a very sharp needle, just like an injection needle, to scrape off the outer layer of the zona pellucida or thin it. And even we can also puncture the zona pellucida. And then finally, laser came out. It is the most convenient method of doing assisted hatching, being widely used for doing embryo biopsies as well. And with the help of a laser, what we can do is we can even thin out the zona pellucida, or we can even make a hole or multiple holes in the zona, which we would presume that would help in hatching at a later stage. So the debate is that whether assisted hatching, the effect of assisted hatching remains unclear and is controversial because there is variation from patient to patient, and it is critical to ascertain that indications of assisted hatching and to identify who might benefit from this assisted hatching procedure and who won't. So the Cochrane review, which was done in 2012, published in 2013, basically looked at assisted hatching in assisted conception in both IVF cycles as well as ICSI cycles. The objective of this review was to determine the effect of assisted hatching on embryos for assisted conception and the outcome, such as the live birth rate and as well as the multiple pregnancy rate. In this Cochrane review, about 31 randomized controlled trials were reported with their clinical pregnancy data that included around 1,992 clinical pregnancies and in more than 5,700 women. Analysis of all these studies, all these 31 randomized controlled trials, showed that the clinical pregnancy rate in women who underwent assisted hatching was slightly better, but the level only just reached statistical significance. So the conclusion of the review was that no evidence of a benefit in the live birth rate with assisted hatching, although there was an increase in multiple pregnancy rates, which we all know is not good. There was some evidence that assisted hatching increases the chances of pregnancy in women with repeated implantation failure, but definitely the sample size was small, so more research was recommended. And the take-home baby rate was not proven to have increased after once we concluded the Cochrane review. So what has happened since the last Cochrane review? As we all know, the debate is still going on. There are some people who are big proponents of assisted hatching, whereas in other groups, people are a little perceptive about it, that whether it is useful or not. So we're going to look at what has happened since 2012 to 2013 regarding this add-on procedure in ART. As we all know, the potential indication for assisted hatching may be recurrent repeated implantation failure. It can be used in poor prognosis patients, and it has been recommended by some circles. And of course, it can be used in advanced maternal age patients. So let's talk about patients who've had previous ART failures, who've had repeated implantation failures. How will this help in this set of patients? A study which came out in 2019, published in Lasers, conducted by Liu et al. In this study, they looked at laser-assisted hatching and clinical outcomes in frozen thought cleavage repeated failures. The result of the study, the clinical pregnancy and the implantation rates were slightly higher or assisted hatching group as compared to the control group. However, the live birth rates, the multiple pregnancy rates, preterm birth, miscarriage, and ectopic rates did not significantly differ between the two groups. So this showed that assisted hatching or thinning of the zona pellucida significantly increased the clinical outcome, particularly clinical pregnancy and implantation rates associated with frozen embryo transfer cycles in patients who've had previous repeated failures. Second set of patients who have a poor prognosis of a positive ART outcome. This study, which was published in Fertility Sterility by McLaughlin and company back in 2019, they looked at, does assisted hatching affect live birth rates in fresh first cycle IVF in both good prognosis patients as well as poor prognosis patients. The conclusion of the study was that the chances of having monozygotic twins was higher in assisted hatching group, around 2.3%, as compared to the control group, which was around 1.2%. However, the live birth rate was around 39.2% in assisted hatching group versus 43.9% without assisted hatching in all patients. But the difference was not statistically significant. So assisted hatching may affect potentially the live birth rate across all patients and in poor prognosis patients in fresh cycle. Hence, caution should be exercised when applying this technology, and we need more studies, more research regarding this. The third indication, a lot has been talked about using assisted hatching, using this add-on in patients with advanced maternal age, because there's a certain concept that with age, aging oocytes, the outer layer, the zona pellucida, hardens, and even in these embryos, the quality of the zona may be compromised, and thinning the zona or even making a gap in it might help the embryo to hatch. This is a systemic review, a meta-analysis, which was published in 2018. They looked at assisted hatching in couples with advanced maternal age. Obviously, in this review, they retrieved about 943 records from 8 randomized controlled trials comprising of about 870 cycles. Now, this is very important. In this review, there was no significant difference in the rates of live birth rate, clinical pregnancy, implantation, miscarriage, and multiple pregnancy rates between both the control group and the treatment group. Another study which saw the effect of assisted hatching on live birth rate following fresh embryo transfer in advanced maternal age. Again, an excellent study published in 2019. They looked at around 892 patients in the study. Interestingly, they looked at 2 sets of patients, 681 who underwent a cleavage stage embryo transfer and 211 who underwent a day 5, day 6 blastocyst embryo transfer. So the results of this study showed that assisted hatching in cleavage stage embryo had a detrimental effect and was associated with a lower clinical pregnancy rate. As we all know now that even for PGT, for embryo biopsy, it is a preferred method or time to do embryo biopsy is a day 5, day 6 biopsy. So a cleavage stage biopsy has shown to have lower clinical pregnancy rates. Similarly, assisted hatching did not have any effect on the outcomes in the blastocyst embryo transfer stage. So those blastocysts could have hatched anyway. According to this study, there was no extra benefit of doing assisted hatching on them. So performing routine assisted hatching for the sole indication of advanced maternal age was not clinically justified according to this study. Now let's talk about a bit role of assisted hatching in frozen thought cycle, because it has been proposed in these patients as well. This meta-analysis of randomized controlled trials, they looked at the effect of laser-assisted hatching on pregnancy outcome of cryopreserved thawed embryo transfers. And as you can see, the rates of clinical pregnancy, implantation, multiple pregnancy, miscarriages, and live birth revealed comparable results in both the groups. Assisted hatching was related to a higher clinical pregnancy rate, a higher embryo implantation rate, and a higher multiple pregnancy rate in women with cryopreserved thawed embryos. Assisted hatching was unlikely to increase the live birth rate or the miscarriage rate. Although this was a good study, but the sample size was small. They only looked at 12 studies. So a large scale prospective randomized controlled trials are required to determine if these small effects are clinically relevant or not. So what could be the potential side effects of assisted hatching? To be honest, we don't know exactly. Why? Because what about the epigenetic effects of a laser when we use it on an embryo? This is the sole reason that a debate has been going on to promote non-invasive methods of PGT, because the embryo should not have to endure the stress of a laser, as we don't know what are the long-term effects of exposing that embryo, what epigenetic changes that embryo may undergo after getting exposed to that kind of thermal shock. This study, which was conducted on bovine embryos, it saw that since continuous thermal stress on embryos was found to lower the messenger RNA levels in de novo methyltransferases in embryos. This was published in 2017. And on the basis of the studies, the hypothesis is that thermal energy introduced during laser-assisted hatching may alter the epigenetic structure through abnormal DNMT levels. So further studies are required to elucidate the impact of laser-induced DNA damage on the reproductive outcome. So my conclusion would be that assisted hatching, the beneficial for implantation rates, but it may be beneficial for implantation rate, but not for live birth rates in cases of previous repeated failure. Assisted hatching may be beneficial in patients who've had a poor prognosis, who come under the umbrella of poor prognosis. However, studies of high quality with adequate power are necessary to further investigate the value of assisted hatching and assisted conception, especially in patients who have advanced maternal age. More prospective research is critical in this regard. So my final thought would be that overall significant improvement in live birth rates has not been evident. So should we really implement a technique whose long-term effects still remain unknown? We don't know the potential damage that it may cause in terms of epigenetics. So is this technique clinically justified? That is the big question. Thank you.